Hey everybody, my name is Tony. I'm from Analytics 8. I want to welcome you to our webinar series. This is actually part of a three-part series we're doing here over the next 3 weeks. That's kind of focused around Databricks. And not just Databricks, but trying to think about it more holistically. And so we wanted to kick things off today with a conversation with Eric, who is from CareQuest, and really have an opportunity to talk about CareQuest's mission, how data fits into that strategy that they have to be able to have a positive impact on the world, which we'll get to in a second. And think about particularly how Databricks has been helping them achieve that mission together. So, Eric, thanks for joining me today. I appreciate your time.
My pleasure, Tony. Looking forward to the conversation.
Awesome. For folks that are actually in the call, you can, if you're participating live, feel free to post any questions in the chat, and afterwards in the comments, we'll watch those for the next few days and be able to follow up and answer any questions folks have if you're watching it later on. Really, the first question I have for you, Eric, and where I kind of want to get the conversation started is I'd love for you to talk more about CareQuest specifically, about the mission of your organization, and be able to help fill people in who may not be familiar with your organization.
Of course, and thanks for dropping more about our organization chat. So, CareQuest Institute for Oral Health is a nonprofit with a mission of improving the oral health for all. We do that by working to make the oral health system more accessible, equitable, and integrated. You'll hear me talk about those terms a few times throughout today's conversation in different contexts. When I talk about it from a mission-driven perspective, it's we seek to improve access to oral health benefits. As many of you probably know, the oral health insurance or benefit system is different from the health insurance system in the United States. So working to improve access there, there are about 70 million Americans who don't have dental insurance. So that's a thing that we want to help solve for. We also know that there's a disconnect between the way in which we treat the mouth and the body, but we also know that the mouth is a part of the body. So working to improve that integration of the medical dental system to create a more equitable and fair system for everybody. Obviously, the quality data and research and analytics that are built on top of that data is one of our most important assets in advancing that mission. Our work within my area around analytics and data insights is to produce some of that core information that helps document gaps in access to oral health care and the benefits of having oral health care for patients, providers, and payers for the system as a whole. That our research and data has been widely featured over the last year, particularly as we approach the election. It's been cited in front of congressional testimony and featured in over 1,500 stories in articles in places like USA Today, Associated Press, New York Times, and the Guardian. We also publish in the scientific literature, leading research on the integration of dental and medicine. It's been cited a couple hundred times in the academic and scientific literature as well. All of the impact of our work is really enabled by our data, our high quality data, the system on which that data is built, and the talented team of data engineers, scientists, researchers, and clinicians who work together to produce this work.
You said a couple times there oral health
Yep.
specifically. And so as a lay person who's not in your space, do you
Yeah.
differentiate between oral health and dental health? Are those the same? Are they
So
different?
yeah, that's a great question. That's a great question. So there are three primary diseases of the oral craniofacial cavities, the place of which your mouth sits and your teeth sit, and throat and tongues and all those things. Primarily, what we think about as dental health is tied to two of those disease states. So it's caries, getting cavities, and getting those filled. Caries is primarily a disease of the young. Early childhood caries continues to be an ongoing issue that we are aiming to address. Caries that have cavities and especially as they spread across teeth, could lead to early tooth loss, malnutrition, as it hard to chew, eat, and can be painful, hard to chew, eat, and swallow, and eventually kind of the degradation and loss of teeth. The teeth are bones in your body. They can, and you could lose those through inappropriate care of your teeth, poor nutrition, environmental factors, whole series of other things. And the loss of teeth or appearance of your teeth plays a fundamental role in how people's self-perception. We've documented, for example, that folks who aren't satisfied with the appearance of their mouth and teeth are less likely to seek out jobs that are beneficial to them because they're worried about having to smile in front of folks. So one disease is dental, though dental caries. The other that's primarily associated with your teeth and mouth and gums is gingivitis or periodontal disease. That's primarily disease in older adults. Periodontal disease is linked to all kinds of other chronic disease states, diabetes, heart disease, dementia. Could be associated with early or preterm childbirth in women, hypertension, whole host of diseases. Now, those are dental diseases. I use the term oral health because we also talk about those, because we also think about oral diseases also tied to oral cancer, so the third major disease state. Oral cancer is relatively rare but devastating illness for folks who have it, very expensive on the system. And also, it's primarily a preventable disease. It impacts your ability to function and is caused primarily two primary causes, smoking, although that's reduced, and then sexual activity, untreated HPV that occurs. So those, when we talk about oral health, it's to talk about it more than just what's going on in your teeth or gums. Those are primarily what, when you go to your dentist. But thinking about the entire disease state that can affect that oral craniofacial complex, think about it just mouth, teeth, gums, palate, everything that's up here.
And you all advocate for both preventative care and just in terms of how we actually pay for that as a society and how we get access for people for that?
Yeah, so within oral health, maybe even more than when you're visiting your primary care doctor, prevention is key in oral health. It's also one of the things that makes oral health and increasing access to oral health particularly intractable problem. All the benefits of receiving oral health care are years, months, years, multiple years down the road, and primarily impact your whole health. So the medical side. So it often feels like dental care and oral health care within the United States is a luxury, and it often is for people. It often gets talked about in terms of appearance. In terms of appearance of your teeth, having veneers or very white or straight teeth. One of the things that we seek to educate on is that it's not just about how you look and feel, but also about how your whole body operates and continues to stay healthy as you get older. So yeah, it's because it's such a prevention-based area, it can be challenging and difficult to document the benefits. If you go to your dentist today, get treatment for your periodontal disease, the benefits don't happen tomorrow or the next week. The benefits, happen over years or, accumulate through your lifetime. So that is one of the things that we attempt to overcome through our research, publication, education is really what is that value for individuals to make sure they have that they access oral health. What is the value for providers, both medical and dental providers, and what's the value for the system as a whole for increasing and improving access to oral health care? Depending on what survey you look at, between 40 and 60% of the population only accesses a dentist in a given year. So we know there's a fundamental care gap that has to be addressed, and those are those are things that we're aiming to address within our organization.
Yeah, I love it. I love the mission. I know my parents sacrificed a lot because it wasn't offered as, standard care. So to be able to make sure
Yeah, it's
pretty cool.
the only one of the only places within our uh, medical system in which we think it's okay to pay substantial amounts out of pocket are in dentistry, and our research shows that those really impact the people in need the most. A
Mhm.
particular, a fact point that we just published demonstrates that folks at the lowest income brackets pay 7 times more of their out-of-pocket discretionary income than those in wealthier families, right? So even if you can access and have the means to do so, it takes a lot more out of your pocket as a proportion of your income because it's so hard to access. So your story is not unique. One of the as my team travels and presents us at conferences, as we sit in taxis or Ubers and Lyfts, and we're having conversations, with those folks, a huge thing. It comes up, oh, you guys are dentistry. There's such a huge need for it, and we've been fortunate to be able to get more attention paid to this issue over the last several months, especially with the election ramping up, and hope that we're seeing real progress in the space.
Excellent. Shifting to more your role at the organization and thinking about the role of data in the organization, one of the things that I'd love for you to share a little bit about is how you all think, because obviously, you guys have data that's coming from all different kinds of places. And so I'm curious how you actually articulate your data strategy when you're talking to your leadership in your role. And, like I know it's so core to your organization, which is not always the case with some of our customers. But in terms of how you articulate that, are there certain principles or defining characteristics that you guys really lean into as a data team in terms of how you service your organization?
Yeah, so I think the easiest way of starting this is with our North Star around our data and analytics strategy, which is to drive actionable insights that lead to improved and equitable whole health outcomes and total cost of care through integrated and accessible oral and medical and social data, excuse me. That's a little bit of a mouthful, so I want to unpack it just briefly. Again, you'll hear some of the terms that I used before. That's intentional. Um, but you will see that the first statement there is drive actual insight. So it's a core value of our data strategy and our team. We could generate thousands of insights if we can't use those, they're not relevant to an organization like ours. So we want to empower stakeholders through direct actual insights, both based on our research and analytics work. So we are producing things with direct recommendations. Everything, if anybody's watching right now, accesses our research after this conversation, you'll see that we always have a particular call to action set of policy implications that we work to make it actionable. The others is to increase and allow access to self-service data that drives our mission-aligned value. So data should not sit in isolation, only within a data team, but rather creation of self-service tools and platforms that allow kind of trusted access to that data, and creates a single source of truth that could be used across the organization. I also use the term integrated. Earlier, I used that term to mean integrated medical and dental care. Here, I'm using it to mean that our data is actually integrated across the oral, medical, and social data. Those are often to your point, Tony, we get data from a lot of different sources. We work to integrate that data together so that we can analyze the impact of oral health on your medical health, on the social determinants of health around equity. So not just thinking about this from the dentistry or the oral health lens, but whole person health are key North Stars for us. So we prioritize some of that kind of data collection. And then the third, accessible. Again, I used accessible a different way earlier, that you should access dental care. And in terms of our analytics North Star, we use that to mean that the data can be accessed in a trusted manner. I talked earlier about that self-service access to data. But again, data sitting in a bucket doesn't help anybody. We want to make that data accessible, but we have to do so in a way that because we have research data, confidential data, information that's data that is, falls under HIPAA rules. We have to make sure that we are protecting those patients those patients, providers, payers who share their data with us. And so making sure it's secure, and we've secured that environment, role-based access controls, et cetera. The other half of creating that accessibility is creating a single source of truth type of model. I have seen organizations tear themselves apart where you have multiple analytics teams using data in very different ways to make very different arguments. To me, a good self-service model was where you have a single reliable source of truth, a data platform that is well managed with a team who knows that data very well, center of excellence, that is able to work with other spokes across the organization to provide best practices, access into the data that they could go grab and use for their own sets of purposes.
I love to how you said, right, and I can kind of pick it out in the mission of your data team and in terms of the strategy. It's aligned exactly to what the mission of the organization is too, which is great, because then it just makes it clear like how integral you all are to achieving that mission, and helps keep your team focused on like the right things of actually like what is the call to action of this. And I love that. One of the questions I had for you within that, because you kind of alluded to this, right? It seems like you have various types of folks that consume data, different levels of skills and expertise in the organization. I'm curious how you all think about how technology fits into your data strategy as a way to be able to help enable different types of people that might approach that data in terms of varied skill sets that I'm sure you
Yeah.
have.
So that's broadly, we define our data products around in three primary ways. So the first and kind of most service level, something I've been talking about, right, is where we have with research or publications work, where we've gone through from data ingestion all the way to interpretation and analysis, and have created a particular written product that defines what that is. That's folks who folks who don't have broad skills in that data, or are interested in a particular type of finding. I talked about the 7 times poor families spend 7 times more percent of their income. If you're just interested in that particular type of data point, people can engage with our existing research publications or work with our team to create some of those sets of publications. The one level deeper down then is what I call curated analytics. Think about data visualizations, dashboards, ways in which people can slice and dice in a very curated manner. So Power BI dashboards or Tableau dashboards are great examples of these. Those are for folks who have have an ability to query data, think about what might be particularly useful for them in their space, either internal to our organization. So, what our philanthropy team might want to look at to help them prioritize where they support grants and where they don't, or where some of our external stakeholders, a policymaker or a advocate within a particular state, takes a look at that data and goes, well, my state is ranked near the bottom. Let me go use this type of information with my key stakeholders. And so those curated analytics then are really, we've defined the product set, but don't define broadly how people interpret or use that data. But rather create tools that allows them to go use it for their own set of purposes. And then the third is the third we might consider often like a silver layer, moving into gold layer if we're talking about medallion structure. But cleaned, structured data that folks who have the ability to manipulate that data through through an existing data platform like R or SAS or Stata, or an existing coding set of coding tools, SQL Server or others, can query that data, pull from that data for their own set of purposes. Still underlying it, I didn't talk about like a bronze or a raw layer. We want to continue to maintain that single source of truth, folks. But
We did put Databricks on the name of the webinar, so
yeah,
it is kind of a leading question to say that in one sense. But I'm curious where Databricks fits into that in terms of the technology strategy you have. Which part are you actually using Databricks for as a platform to help enable those different pieces you described?
yeah. So we'll talk about two elements first. So some key things for us in picking that technology. What I call the three S's right now. They have a technology has to be stable, secure, and scalable for us to use it within our system. For us to identify that is a potential solution. Stable here means not a company that's pretty well embedded. We think it's going to stay around for a while. We know that there is so much churn in the technology space right now, especially with increased use of AI. We want to make sure that if we invest in a solution, that solution is going to stay with us for at least several years. The second component is that it has to be secure. So because we have HIPAA compliant data, research data, we need to be able to both document through BAs or others that it's a secure environment, and use things like role-based access controls to make sure that only folks who can see certain parts of the data aren't able to see that data. They don't get to see everything else. And then the third a big driver for us is scalable. Our data volume doubles or triples every year, often more than that. So the solution has to be able to grow with us as well. So that all of that led us to Databricks' solution. Databricks right now is our enterprise data lakehouse. We use it we use some data ingestion tools from outside, but every part of the process from data ingestion and the bronze layer all the way up through creation of gold layer aggregated data sets that get used for research curated analytics right now happens for us within the Databricks environment.
Okay. I know that Databricks has been part of the story in terms of the CareQuest piece of this specifically, but I'm curious how you've noticed increased or enhanced capabilities using Databricks as a platform compared to like other approaches that you've worked with, even if it was before CareQuest, right? But just like things that you notice that are especially exceptional in terms of the experience it creates for the different practitioners and folks that interact with the platform.
Yeah, I think so. That ability to create a single data lakehouse is massive, right? We don't need to have a separate data warehouse and a separate data lake where data sits. Rather, they're in the same platform, and we can and people can query different parts of that data based on their existing roles. So having it centralized architectures has been massively helpful. The other is the ability of cloud compute to really to absolutely speed efficiency. Example I like to give here is when we moved from our on-prem SaaS environment into our Databricks and cloud compute environment. Processes which we would used to have to start over the weekend and come back and hope that they ran by Monday morning. Take minutes or hours or minutes. I think we shaved nearly 100% off of our solution time. Again, run from all weekend to something you click run on, come back 5 minutes later, and it's run for you. So the efficiencies that we have gained through that centralization and our increasing ability to leverage those cloud compute functions as part of Databricks have massively benefited the team and the organization.
That's awesome. Uh, I know that Databricks has evolved a lot, even from when you originally picked it. And so I guess
Yeah.
I take it, and I know your organization too, the needs have evolved. I'm curious if there are things that have been pleasant surprises in that evolution in terms of and not maybe just with Databricks, but in terms of the whole space and capabilities that we have in the analytics community now with technological advancements, like how you're kind of thinking about, adopting, more of an AI disposed view, I guess, within your team and piggybacking on that evolution, I guess.
So Databricks as a product has continued to grow and evolve at a pretty impressive rate that we've seen. Not turning it into an advertisement for Databricks, but
No, no, no.
acknowledging the growth of acknowledging how much that platform has evolved over the last couple of years. So two big benefits that we hadn't originally considered. The first I talked about a little bit, its role as our data lakehouse right now is when we originally started using Databricks, we had a separate enterprise data warehouse, and Databricks was being used primarily as our data lake solution, ingestion, kind of silver layer transformation. So that evolution as we become decentralized. In addition, the expansion of their data cataloging logging tool. So they have a Unity catalog right now. So they call it Unity catalog that has evolved fairly rapidly over time. And so now we can now we have a centralized governance platform and data lakehouse platform. So having it all in that kind of same set of tooling has been very helpful, and we could kind of draw that direct connection. It hasn't replaced some of our other data governance tools. We continue to use some overarching kind of data governance, privacy assessment type tools, but for within the analytics team and for folks who for folks who interact with that data regularly, having a one-stop shop for data catalog, analytics, data lakehouse has been really valuable.
Yeah, we've seen that as a pattern of folks that purchased Databricks around the same time that you did, that were mainly using it for transformation engine and
Yeah.
just like those purposes, and then staging it somewhere else. And we've started to see that consolidation too. So it's kind of interesting evolution. I just have one more question for you
Yeah.
here. I know it's a pretty short webinar here, but we'd love actually for everybody, if you would like to, you can connect with either of us on LinkedIn, continue the conversation, obviously, like we said, in the comment sections and things. But the question I have for you, which kind of points to our next two webinars even, but what are you excited about in terms of the future of data as your organization, without making big promises, right? We don't want everybody to think like, you've self-realized AI for everything or whatever, but I'm curious, like, what is exciting to you about what's coming around the corner and how it can impact your organization?
So excited about a lot of things. Massively exciting time for those of you who are using generative AI, machine learning tools, etc. That to enable and empower better self-service access to data so that people have data that's immediately accessible to their level of interest and ability to use that. AI tools are, like I said, incredibly powerful. They are still, like all data analytics products, crappy data leads to crappy outcomes, garbage in, garbage out. Will always remain a role for fundamental data science, data engineering teams to create that high quality data sets, to create those high quality data sets and analytics. The ability to create more self-service platforms through curated data analytics or others. What it allows for, and what I see on the horizon is is an ability for our data engineering, data science roles to work at the top of their education and ability. So rather than running a routine report you've run a million times before, those could be automated, really diving into the very deep technical and exciting applications for data scientists, analysts, et cetera. That's the real exciting stuff on the horizon, both for my organization and I think for data analytics teams across the space.
Yeah, I agree. Well, Eric, I want to thank you for taking time to share not just how your work and your team's work has positively impacted CareQuest, but how you all, as an organization, are helping our society as a whole. I learned a lot today, so thank you. Oral health, dental health, not the same thing.
There, I got
You
it.
have one takeaway, folks. That's the main takeaway.
My pleasure. It's been a fun conversation, Tony, and look forward to continuing the conversation. As Tony mentioned, feel free to reach out to us, to reach out to me via LinkedIn or other sources, or engage with our CareQuest resources. I know Analytics 8 has plenty of resources as well. So thank
Yeah,
you.
thank you. Yeah, and again, there's 2 more webinars coming up the next 2 Fridays that are going to be very focused from a practitioner perspective. So if you're interested next week in learning, if you have Databricks and you're trying to figure out how do we find the sweet spot for optimizing price and performance, I know that that's been a very entertaining LinkedIn saga this week between a couple companies who've been going back and forth on that. Love to dive into that next week on that front. And then we're going to talk about how Databricks can actually make it easier to add AI to your strategy organization the 2 weeks after that. So again, thanks everybody for joining. Thanks to those that are watching after the fact, and look forward to continuing the conversation online in the comments. Thanks all.